Good day, Wonder Nurses. I'm Nurse Anne. I prepared various nursing exam questions for you to gauge your knowledge for your upcoming examinations. As always, you have 30 seconds for each question, then the correct answer, rationale, and a short discussion will be given after the 13 questions. So get a pen and paper and let's start. Time's up. Let's now answer all the questions. Question number 1. The patient in the scenario needs an emergency craniotomy. Generally, there are two situations in which informed consent of an adult patient is not needed. One is when an emergency is present and delaying treatment to obtain informed consent would result in injury or death of the patient. The second is when the patient waives the right to give informed consent. Letter A is inappropriate, while letters C and D will delay the emergency treatment. Therefore, the correct answer is B. Question number 2. The correct answer is letter C. Cosmos respiration is a sign of metabolic acidosis, and it is common in patients with diabetic ketoacidosis. Letter A is Cheyne-Stokes respiration. It is often caused by strokes, traumatic brain injury, brain tumors, metabolic encephalopathy, or carbon dioxide poisoning. Letter B is apnea, while letter D is Biot's respiration. It is usually caused by damage to the medulla oblongata by stroke or trauma. Question number 3. Acculturation is a process of learning a different culture to adapt to a new or changing environment. Therefore, the correct answer is letter A. Letter B describes a subculture. Letter C describes ethnic identity, while letter D describes an ethnic group. Question number 4. The incident report should include the patient's name, age, and diagnosis. The report should contain a factual description of the incident, any injuries experienced by those involved, and the outcome of the situation. Letter A is the only option that describes the facts as observed by the nurse, while the other options are interpretations of the situation and are not factual information as observed by the nurse during the incident. Question number 5. It is important to monitor the prothrombin time of the patient while taking warfarin. Generally, the normal range of PT ranges from 10 to 13 seconds. Based on the latest result of the patient, 35 seconds is high. Therefore, the nurse should anticipate that the patient would not receive further doses of warfarin at this time. Note: warfarin is taken orally and is contraindicated for pregnant women because it can cross the placental barrier during pregnancy. If there is an overdose or toxicity, the antidote is vitamin K. If you want to learn further about pharmacology, you can check it here or its link in the description of this video. Please don't also forget to click the subscribe button to keep you updated on our latest video. Let's continue. Question number 6. A fluid volume excess is also known as overhydration or fluid overload. It occurs when fluid intake or fluid retention exceeds the fluid needs of the body. Assessment findings include cough, dyspnea, crackles, tachypnea, tachycardia, elevated blood pressure, bounding pulse, elevated CVP, weight gain, edema, neck and hand vein distension, altered level of consciousness, and decreased hematocrit. Letter A, B, and D are signs of fluid volume deficit. Question number 7. Nurses are frequently exposed to patients from various ethnic, cultural, or religious backgrounds that are different from their own. We should be aware and sensitive to their unique health and illness beliefs and practices. Acknowledgement and acceptance of cultural differences with a non judgmental attitude are essential in providing culturally sensitive care. Going back to the scenario, although herbal substances may have some beneficial effects, not all herbs are safe to use. Clients who are being treated with conventional medication therapy should be encouraged to avoid herbal substances with similar pharmacological effects because the combination may lead to an excessive reaction or unknown interaction effects. The nurse would advise the client to discuss the use of the herbal substance with the physician. Therefore, the correct answer is B. Question number 8. For you to be able to answer this easily, you should know the normal range of body temperature in Fahrenheit, or at least learn how to convert it to Celsius. The normal body temperature can range between 97 and 99 degrees Fahrenheit. If the patient has a temperature higher than 100 degrees Fahrenheit, the blood transfusion should not be started until the physician is notified and has given further orders based on the latest vital signs of the patient. Therefore, the correct answer is D. Here are some important things to note about blood transfusion. During cross-matching, there must be at least 2 nurses. Use only plain NSS. Monitor the patient closely for the first 15 minutes and assess every 30 minutes. If there's a positive adverse reaction, stop the blood transfusion immediately, then notify the physician. Question number 9. If a neck injury is suspected, the jaw thrust maneuver is used to open the airway. The head tilt chin lift maneuver produces hyperextension of the neck and could cause complications if a neck injury is present. A flex position is an inappropriate position for opening the airway. If you want to refresh your knowledge about the updated basic life support discussion, you can watch it here. The link will also be available in the description of this video. Let's continue. Question number 10. The patient here has phlebitis of the vein. Phlebitis at an IV site can be distinguished by the patient's discomfort at the site and by redness, warmth, and swelling proximal to the catheter. If phlebitis occurs, the nurse should discontinue the IV line and insert a new IV line at a different site. Coolness at the site would be noted if the IV catheter was infiltrated. An allergic reaction produces a rash, redness, and itching, while a major reaction such as hypersensitivity can cause dyspnea, a swollen tongue, and cyanosis. Question number 11. The normal serum sodium level is 135 to 145 mg per liter. Thus, hyponatremia is evidenced by a serum sodium level lower than 135. Hyperactive bowel sounds indicate hyponatremia. It also includes increased urinary output and decreased specific gravity of the urine. The other options are signs of hypernatremia. Question number 12. To answer this kind of question, you should know the normal values. The normal pH is 7.35 to 7.45. The normal HCO3 is 22 to 26, while PCO2 is 35 to 45. Based on the ABG result of the patient, pH is within the normal range. PCO2 is low and HCO3 is normal. Since PCO2 is low and it is considered a respiratory condition, the interpretation will be respiratory alkalosis. Therefore, the correct answer is A. To know a simple strategy on how to interpret an ABG, you can learn it here. The link is also available in the description of this video. Question number 13. The normal serum potassium level is 3.5 to 5.1. Thus, lower than 3.5 is hypokalemia. Potassium deficit is a common electrolyte imbalance and is potentially life-threatening. ECG changes include inverted T waves, ST segment depression, and prominent U waves. Therefore, the correct answer is A.
Thank you for listening. I hope you learn and understand something. If you want more videos, don't forget to subscribe. See you on the next video.